Grealish on behalf of the regional group.
Taoiseach, there's been a lot of debate in recent times about the state of our health services, growing waiting lists, emergency department overcrowding and more. But what may be missed in the middle of all this talk is how much services in the western and north-western part of Ireland lag behind the west of the country in so many ways. A capacity review carried out by the An Hospital Group in 2019 found that almost two-thirds, or 64% of the infrastructure at the region's biggest hospital, University Hospital Galway, was classified as not satisfactory or unacceptable. And in the case of its sister hospital at Merlin Park in the city, the figure increased to a shocking 95%. During 2022, waiting lists for inpatient and outpatient pain relief treatment in Galway increased by 75%, during a period when the rest of the country actually saw a tiny increase of just 1% in the waiting lists. The numbers in Galway waiting 18 months or more, many in severe pain, are now more than 3 times greater than this time last year, while the rates in the rest of the country dropped by almost 1/5. There are other specialities too, such as orthopaedics, where the experience of patients in Galway falls well short of what has happened in the rest of the country. Taoiseach, the west of Ireland currently has the lowest survival rate in Ireland for breast and lung cancer, and this is in a country that had the highest rates of cancer in the EU 27 in 2020. Experts in the field point out that the late diagnosis leads to where patients' outcomes but the facilities for the treatment of cancer in Galway are not fit for purpose, and cancer patients are competing with elective and emergency patients for vital life-saving treatment. I welcome the recent announcement that a new cancer care centre at UHG is to be included in the HSE's National Service Plan this year, and I want to compliment Professor Michael Curran for his excellent work on this project, and I hope that it will be progressed as a matter of great urgency. But we need similar urgent action to be taken in relation to the rest of the health services in Galway and the West. At the very least, bring them up to a standard that is fit for purpose. The West is starved of proper services, and I am calling for a task force to look at what is going wrong with the health services in the region and what needs to be done to improve them. You may point out that a new elective hospital is intended to be built on the grounds of Merlin Park Hospital in Galway, but how long will it take for that to become a reality? Realistically, Taoiseach, it could take 15 years and more, and in Galway the radiotherapy unit recently opened took over 14 years to deliver. There are so many instances in the provision of health services where Galway and the West are falling well behind the rest of the country. So I am asking you here today, Taoiseach, what are your government's plans to improve the delivery of healthcare to the people of Galway and the west of Ireland, and to bring the delivery of healthcare up to an acceptable standard and to ensure the proper resources are put in place?
Germagad as the quid cashed. Reduce Boatlum, Weakus Agawa, Lenar Fern Slancha Galer, Don Coram, Ata, Ahelaher Aku, in a Rospedale, August of Pubble, La Ling Travesha, and Ganohach. Shinen Fog Will, Nalian Lapaka Hospedale, away do a going. Tom Budget Slancha Niasmo Riv, or Ismo Riv a going. Toniasmo Doctori, Altri, Manok Haurach, a Gobber in a Hospedale, and near her, in Oliva, August and Part on Shira. Deputy, I just want to agree with you on one important point, and that is the point that we do need to invest in our health services all over the country, but also in the west of Ireland. And I share your frustration that so many important projects in the West have been delayed, particularly the emergency department, the paediatric and maternity units in University Hospital Galway, which should have been under construction by now, in my view, let alone gone to planning, and that is something that I'm going to be pursuing with the Minister of Health and also Minister Donoghue over the course of the year, so that we get those projects up and running. And I'm aware, of course, that there are other important projects that need to be advanced as well, like the medical assessment unit in Sligo and in Castlebar, and also the cancer centre, which you mentioned. The Sales University Hospital Group, or Healthcare Group rather, as deputies will know, covers 6 hospitals in the west-northwest region and serve a very significant population, covering more than 830,000 people. And I think we need to plan for a population of 1 million in that region over the course of the next 20 years, and that's the way we should see it, not as a number of counties or cities, but also a region of 1 million people. And a region of 1 million people should have the kind of health services and specialist services that it deserves. The combined budget for the hospital group is over €1 billion, and that is an increase of 24% in 5 years. And as I say, I recognise the importance of investment, and we're committed to working with the HSE and the hospital group and individual hospitals to make sure that that happens. In relation to cancer services, cancer survival rates have increased significantly over the past 2 decades in Ireland and continue to improve, as we know from the National Healthcare Quality Reporting System. When it comes to lung cancer, which is the leading cause of cancer death in men and women in Ireland, our 5-year survival rates are now above the OECD average, and the same goes for breast cancer. In the HSE West area, the survival rate for lung cancer is 16.5% compared to 17.1% nationally, a gap of 0.6%. And the survival rate for the HSE West region for breast is 8.25% compared to 82.9% nationally, a gap of 0.4%. And it is important to say that there are many factors, not just one, that may give rise to this discrepancy. In relation to the elective hospitals, which we're building as part of the Saointe Care reform plans, we're committed to them, but we are realistic that it will be 2027 or 2028 before patients will be seen in those hospitals, and we do need interim measures, and that's why we're working on the surgical hubs, for example, which will help to bring down wait times in the meantime.
Thank you very much. Deputy Grealish.
Track record of the HSE, I kind of see that happening. But Taoiseach, I appreciate that there's been some investment and there are plans for further investment in health services in Galway and the West. But the region is still lagging behind the rest of the country and needs much more. In the past, I have raised the need for a minor injuries unit in Galway. I visited the excellent facility in Roscommon and I was extremely impressed with the efficient way in which they deal with everything from broken bones, lacerations, sprains and strains to minor scalds and burns. Taoiseach, there are 15 of these minor injuries units around the country, helping to relieve the pressure on busy hospital emergency departments, but none in Galway. The emergency department at UHG remains one of the busiest in the country, without the relief provided by thousands of people being redirected to a minor injuries unit. Taoiseach, can you give a commitment that one of these minor injuries units will be built in Galway to help alleviate the pressure on UHG?
Thank you.
Thanks, Deputy. I think almost all regions in the country will say that they are underfunded, are under-resourced when it comes to healthcare. You've made the case very strongly today for the West. I've heard the Deputy beside you make the same case for the South East on many occasions, and many of my colleagues would have made the same case to me in relation to the Midwest only a few weeks ago. And the truth is, it's actually quite opaque where the truth lies and where the balance of resources and funding is. And I think that's one of the reasons why we need to move towards population-based funding in healthcare, and that is very much part of the government's reform programme. I've seen minor injury units work extremely well around the country. I can't make you a commitment here that we're going to do what you say, but I think they make a big difference, and I've seen them work extremely well in all parts of the country. People not having to go to very busy, crowded emergency departments with minor injuries, and more importantly, people with minor injuries who do need to be seen, who do need healthcare, getting that healthcare and getting it in an uncrowded setting, in a more humane setting, and within a few hours. We're certainly happy to give consideration to a minor injury unit for Galway, but not at liberty to make that commitment here and now, but we will certainly take it seriously.
Thank you very much, Taoiseach. That concludes Leaders' questions.